All right. Great. I'm going to call the meeting to order. Are there any questions about any items on the agenda? All right.
Talk about the strategic partnership grants item for a few minutes, just to review. Just a few minutes of discussion on that item.
Sounds good.
Great. I just want to make sure that I am tracking as we look at proposed different changes. Is the big picture concept here that we would we'd update the resolution regarding how we fund, and that there would still be some discretion within different funding categories like tipping points or Isaac Coleman to establish specific guidelines and criteria? That's
Okay.
correct.
To the strategic partnerships.
Okay.
Yes.
And it
Great,
only
but-
affects that. It only affects that. It doesn't change any other of the fund mechanisms.
Correct, because those other ones already have communities oversight committees already that does that allocation. So this one, what we were talking about was strategic partnerships.
Okay, great. That was, I think, the primary thing I wanted to clarify. I think the second thing was just hearing people's thoughts. There's language in there about equitable distribution across districts, which there's a lot about that I like, but we have districts that have just changed and will be changing again probably in 2021. Just kind of wanted to think that through a bit before we head into tonight's conversation on that. And also the question of whether we need to drill down into a little more detail on what we mean by that, if it's sort of organizations based in the different districts, if organizations would need to somehow demonstrate that they're serving, how many people they're serving per district. I like what I think I understand as the sort of spirit or intent of it, but I do feel like there's some practical complications that could arise. Thinking about if there were some issues that really are hitting one district particularly, but not playing out in others, just some of the challenges that might come up, putting above and beyond the basic idea that districts are on the move and will continue to be for a while.
Are there, how do the staff interpret that currently?
We were looking at making sure if there's a nonprofit that applies for grants, that we will look at where they're located as well. But more than that, we were looking at how we serve the population, making sure we're serving people from all districts, not just in the city of Asheville, District 1.
So it's both where they're actually located and where they serve. Is there equal emphasis on both? I mean, the reality is there's a lot of organizations whose offices are in Asheville that serve the whole county or beyond. So, so is there more weight given to one or the other, or just it's kind of still open and just I don't know, or how formulaic is that?
It hasn't been formulated yet. We were still pretty open on what the criteria would look like. So we're bringing that to you tonight. And if you say that you wanted more weight on where you live as being served versus where the organization is located, that's how we would weight it. But that was open. But we want both. We want that you're serving the population where they live, as well as where the nonprofit is also located. But we hadn't put a weight to those things yet.
Okay.
Okay, so maybe more discussion tonight. Okay, this is helpful to hear sort of what thinking is on those. Thank you.
All right. Okay, if there's no other specific items, let's move on to staff updates. The first one is the Waste Pro contract modifications.
Mr. Chairman, members of the board, good afternoon. Hope everybody's doing well. And the topic of conversation we're going to be discussing today is, again, on the residential waste and recycling collections contract in the unincorporated areas of Buncombe County. And this is a contract that the county has entered into with Waste Pro. And the effective date for this new contract is January 1st of 2020. So in response to citizen feedback and concerns, staff has went to work with Waste Pro to identify viable options, and we're here today to discuss a couple of contract amendments that are targeted to better serve our communities. And please note, these proposed amendments are scheduled for your regular meeting this evening for consideration, and Mr. Frew is going to help present that this evening during the regular meeting. So the first proposed change is regarding the bear-resistant cart options. So current status, current contract language, if subscribers elect to use a bear-resistant cart, the current option and the only option is for the subscriber to purchase a bear-resistant cart for $300. And the proposed change language on the contract would be allowing that option still, where folks can purchase the bear-resistant cart at $300, or they would now have the option to lease the cart at $9.50 per month. Or in certain situations where subscribers already have a certified bear-resistant cart, they would be able to WestPro would issue a credit for that cart, and that would reduce the monthly payments to $575 per month with that trade-in. And you see the note on their schedule impact. That is an approximate 2-week schedule impact that we're estimating on that, because WestPro will be reaching out to subscribers and letting them know of the change pending approval this evening. And the call will be focused on no further action is needed unless you would like to participate in the lease option for the bear-resistant carts. So it gives everybody that information, and they can elect to go on to the website and make that change, or they don't have to do anything if they're comfortable with the selections they've made. So we will be sending out an email to the commissioners prior to the blast calls going out, what areas that are targeted to go out and when, so that you'll have that information and know ahead of time when these calls are going out. So that is the proposed language change around the bear carts. And the next program that we're talking about is also proposed, an elderly low-income discount program. And you can see from this chart that the qualifying parameters for eligible subscribers include elderly, 65 years or older, and low income, which that threshold is below 150% of the federal poverty level, and a difficult driveway. So the number of qualifying subscribers right now, the maximum is 700, and it is a first come, first served program. And we estimate the value of this discount program to be approximately $210,000. When you think about each one of those accounts, if premium service were applied, that's a up to $25 additional monthly charge. So that's what we're negotiating on, or have negotiated with WastePro, in exchange for allowing WastePro to be eligible for a $4 per ton rebate program, and and that would basically allow them to be eligible for that tonnage that is collected through this residential contract.
I have a question, Dane.
Yes, sir.
And if you are one of the 700 subscribers who participates in this program and you meet the criteria, how long do you get the benefit?
So we have it written as throughout the term of the contract. The base term is 5 years, and there are options at the end of that 5-year term. So 2 and 2. Mr. Frew, I'm looking towards you. That's my understanding.
The only difference I would throw in there is that it is open to 700, and we're working with WastePro to develop a system where we can share accounts. So we've heard that Chip mentioned before that sometimes customers don't pay for a month or two and then they get dropped. So the point is that we need WastePro and the county solid waste to cooperate to match those lists. And if people drop out, then we can open back up. Exactly how we do that mechanically, still not quite sure, but there have to be some constant maintenance of the program to make sure people know that they can reapply at a later date if they are, for whatever reason, dropped from the program. For non-compliance, typically, I would imagine, moving out of the jurisdiction or just dropping service.
And so, I mean, I like this concept. I guess my questions or concerns would be, we don't really know at this point what the full demand for this will be. It might be less than 700, might be more. We just don't know. We're not going to know until we really put it out there, right? So If it's less than 700, it's probably not a concern. If it's significantly more than 700, I guess my concern is if someone simply, like if there's a stampede to get in on the program, right? Like if people really want it and demand outstrips the slots, then it doesn't seem like it's, I mean, I think it's fair to say first come, first serve. You have to have some process, but for the long term, if someone didn't get in on this first round, but then someone else gets in, plus any renewables, for one kind of category of people to get this great benefit for 5 years or maybe even much longer, and other people to not be able to do it, that's my concern, is that it seems like there maybe should be some process whereby, I mean, at least at the end of this contract term, there's sort of a chance to reevaluate it. Maybe we make it less generous, but open it up to a larger pool of people. I just want it to be equitable, you know, for all the people who really fit the criteria.
Sure.
In the long run is my concern.
Absolutely.
Or would you consider an annual conversation, where we review it annually?
I mean, right now, if someone gets in, they'd be locked in for 5 years. I don't know. It seems like I'd rather reevaluate it sooner, especially if there's significantly more demand, to be able to have a chance to maybe have a broader pool of participants. So I wonder if we could at least maybe include some language saying the county has an option to reevaluate this after 2 or 3 years to kind of get a sense for how it's going, and if we wanted to make adjustments, we would have some options to do it. Just kind of thinking out loud, but what do other folks think about this?
Yeah, and as you're thinking through this, obviously open dialogue here. The next slide has some of the check the boxes on the application. So this is the talking about the criteria. You know, obviously the age criteria there, the household or the participation in a federal program, which Health and Human Services would help us to evaluate this part of the application. Application starts with solid waste. They would apply to us, and then we would look to our partners in HHS to help us evaluate the information that's been provided. And you know, obviously there's the rear door service that we've talked about in detail with the doctor's note. So that's separate. That's another part of the criteria that, you know, this demographic we're talking about now, it's folks that maybe didn't qualify for the doctor's note. You know, they have folks that are able physically maybe to move the material to the collection point. But, you know, it would be really helpful for them to have that premium service based on those parameters. And that just helps them financially, you know, with the burden of the $25 extra per month. Let's see here, gone dark. So the third bullet point there, sorry, my screen's, as we just talked about, I do not qualify for the premium service through WastePro, which requires a doctor's note. And then, you know, the last one is there's no able-bodied person residing at the address that is able to move the rollout cart to the collection point. So that's a spreadsheet that will be provided from Buncombe County to WastePro. And as Mr. Frew alluded to, that's something that we have to communicate on. We have to keep close tabs on that with a subscriber list, making sure that these folks are still participating in the WastePro program, and you know, just working through on regular evaluation of who's on that list, and making sure that communications are clear with WastePro for that 700. So you think about the 700, the negotiation point is the $4 per ton. That's the rebate on our end of what we're allowing for WastePro. So.
Commissioners, we're happy to bring this back in March to give you an update on how many an update in March, so we can share with you how many subscribers we had, and let you know if we've had more than 700 or less. And of course, we can work on some contract language that gives us some flexibility moving forward. So if we have more, then we can negotiate for additional number of subscribers. So we'll work on that contract language between now and your meeting.
Well, the only thing I want to make sure that that we're bringing closure to the contract. You know, I think we should get updates, pretty quickly on a lot of things. And that would be not only that, but I just want to make sure that we're going to be able to bring closure to the contract. I don't disagree with some of the concern. I just want to make sure that we can bring, closure to the contract so we can not be meeting on it every
Yeah.
2 weeks,
Sure.
I'd like to go ahead and get it done, so.
Yes, sir.
And Commissioner, to give you some context, when we checked with the tax records, we had about 300 seniors that were in that homestead exemption. So this is doubling the folks that would be on that homestead. So,
Which is probably going to be okay.
But there's a lot more people who meet these criteria than that, right?
this should be. That's why it's actually a double, and we're hoping to capture the majority of that group.
Do we have any estimates? I mean, 700 is the amount that, we picked a number based on the volume fee savings, right? So that's kind of how we came up with the number. But the 700, I mean, it really is sort of a guess, right? We really don't know what the demand will be at this point. It's just hard to know.
Correct, and I understand everybody's situation. We've got, as we've talked about, a lot of folks bring their own material to the transfer landfill, and it's hard to understand exactly what all of the participants interested in this program are doing right now. So I think it's something that, we evaluate, we keep a close tabs on the number, and when we're getting on up in the 500-600 range, we've got to really take a look at that and inform the board on where we're at.
Is that it, Dane?
Yes, unless there's any further questions.
Just a more general update. How would you describe the volume of calls and concerns that the county's continuing to field? I'm still getting a pretty steady flow of messages from folks,
Yeah,
or some folks in particular, but yeah.
Right. It's certainly been it's died down substantially from the initial postcard going out.
Yeah.
There was obviously the influx. We talked about the numbers last time with solid waste receiving around 350 calls in that time frame. It's died down to around 50 to 60 calls at this point since we've talked last time.
Okay.
A lot of questions, but a lot of people just calling saying, hey, I wanted to make sure that I got my cart ordered, and just that general feedback thing of communications. So it has died down some,
Okay.
and I do anticipate an increase in calls coming back in, and that's something important we wanted to mention is, we're solid waste department, we're going to be adding resources as far as being able to have folks answering phone calls as they're coming in.
Great.
We're going to gear that up middle of this month.
Great.
So that we can help answer calls from folks and expedite that. So.
All right. Thank you, Dane. Appreciate
Thank
it. All right, next up is a discussion of comprehensive facilities study. And Michael Mason and Ronnie Lunsford are going to help us out on this one.
Commissioners, I'm going to jump in and tag team with Mike just a bit on the first couple of slides.
This monitor's not working.
You ready, Mike?
There's nothing here. I can click, but
Okay,
I can look
if you
over
can
that
just
way.
click through for me. So, good afternoon, Commissioners. This item is about our comprehensive facility study, and we're sharing information about our need for a comprehensive facility study. And if you see fit, then we are able to come back before you at your next Commissioner meeting with a formal request. Can you move to the next one, please? So we just, this is the agenda for this presentation. You'll notice the first slide is actually an update about the detention center facility needs assessment. We just have one quick update we want to share with you about that. And then after that, I'm going to turn it back over to Mike. So, oops.
Everything went dead. Max is working.
There we go. So if you'll recall, you have $225,000 in your CIP for this year to study in addition to the detention center. And internally, we had talked about combining this study along with a comprehensive facility study. But in researching this project, we've actually uncovered some drawings for a potential detention center expansion, and we just wanted to share that information with you because we may or may not need that $225,000 now. This is from a 2008 study that was done that resulted in the first expansion. Along with those drawings, there is rough drawings of an additional expansion that would include another 240 beds. So we just wanted to make you aware of that. We're researching this option, whether it's viable or not. We've met with the sheriff and general services, and Lee Creighton has crunched some numbers and working to determine if this is something that we can move forward with instead of conducting that $225,000 assessment. So I just wanted to make you aware of that.
I'm sorry, can you clarify what would we be moving forward with?
Just the study. We had $225,000 in the CIP for conducting a study in the case that we may need that to determine where an expansion may be.
Right.
So with this information, we're going to evaluate this option instead of moving forward with a full-blown study at this point. Now, as we crunch those numbers, we may need some of those funds, or we may need all of them. We're still trying to determine, which way to go. So I just wanted to make you aware of that.
Help me out here, because I feel like this presupposes that there would be a new facility built, and I'd understood that what we were sort of using the funds for to take a step back and kind of assess the full range of options that might exist relative to the future of the detention center. So not necessarily, which is a different question than drilling into a presupposed 200 or however many extra beds. So I think that would be maybe I had misunderstood the original conversation and the allocation, but I thought it was sort of let's look at sort of every option on the table related to the way this might progress.
And I know that we are looking at the various programs for reducing the jail population. So that continues. And I don't know if Lee wants to jump in and
I'll
share.
jump in. So you're
Okay.
exactly right. Our goal is not to build a building, but to have a plan. Because the numbers are so high, our goal would be, if we did have to pull the trigger, do we already have that study on the shelf that we can pull? We found this drawing, and we found that they had done some work back in 2004, 2008 around that. So what we're saying tonight is that we would take the 225 that's been allocated for a full study and reevaluate this plan. So instead of looking for new land or looking for options or space or what can we do, we have the preliminary drawings now. Let's take that and start as our starting point instead of starting from scratch. So not that we're looking at building a jail at this point, because that would not be the goal, to build a jail, but to have the plans ready and to reevaluate this and see if it's still relevant today.
I mean, I think it's wise being ready for, all the scenarios. And what I'm hearing you say is that we've located work that has already been done, and rather than spending additional money, we want to evaluate the work that has already been done, and then see what makes sense or how it works within all of our other programs, and come back and update the commissioners on, where y'all land. So, hopefully sounds like it'll save some dollars, and, I'll be looking forward to see what comes back, and how it fits within, all of our other plans and programs. So.
Is this proposed drawing, is it on land that we already own?
It is.
Yes, sir.
It is.
Yes,
Next to the existing
Yes, sir.
facility?
that's correct.
On the parking lot?
It's a parking lot
A
there.
parking
holds
lot.
about
Oh, it's the
11
parking
vehicles.
lot.
Behind it?
Yes, sir.
Okay. Wanted to make sure.
But and is it specific to a detention center? Meaning,
Yes,
Yes.
it was drawn into the plans as an option for expansion in the event that it was needed.
Most of the infrastructure is already there too in the building that it's adjacent to it. So all your heating and air conditioning slabs, all your boiler slabs, things that feed those facilities infrastructure, they're already there in place.
but parallel to that, we could say there's the capacity to build there, but it could be a mental health treatment center.
Yes.
Okay, I just want to
Yeah.
Yes.
flag,
We're
this
not-
is a
we're
really
not-
important conversation. The county's working very hard to reduce the jail population, and I
Correct.
think it may seem a bit pedantic, but I do think it's critical that we
Yes.
highlight that and as we're moving forward with it.
Yeah, I don't take it any other way than it's good planning. It's already there. We're not Staff's not trying to establish policy. This is a very smart approach to something that may or may not be needed. And if it's needed, we'll have the work. It'll be there, and we'll be able to push the button at that time. And maybe it's used for, other purposes, but, it's certainly right there, and certainly makes sense at least to see what the study, shows us.
So we bring that forward to say the 225, our plan is not to spend that. Let's just reevaluate what we have and put that aside. But in the meantime, as we were going through this process, we realized that there's other needs across the county that we want to talk about. So I'll let Mike go ahead and talk a little bit then about the other county buildings that we've noticed.
Okay, thanks, Sybil. Good afternoon. Moving on to the comprehensive facilities plan, I wanted to provide you with some feedback on some background information concerning the cost to maintain our current county buildings. The average age of our buildings is over 50 years of age. We have $9.25 million in planned capital projects this year, and FY20 building maintenance and grounds costs forecasted to be around $740,000. So we feel a comprehensive facilities plan could help gain control over some of these needed operational costs that we currently are incurring. General Service has developed this type of plan for AB Tech's Victoria campus a few years back, as well as we're looking forward to the Inca campus that we're going to be kicking off in the near future. So a comprehensive plan answers important planning questions such as, are buildings being used efficiently? What are our current and future need space? Are there opportunities to improve customer service? And are aging buildings worth investing in? And if so, what's the cost of those investments? Are there opportunities to better match design with the needs? For example, the tax collections office. It's hard for our citizens to actually find parking, so it's not really an ideal location for our citizens. Plan on evaluating 26 county buildings, roughly 1.7 million square feet. We're looking at 12 libraries, but we're working with Jim Blanton because he's working on getting a grant that may pay for the comprehensive plan for the libraries. So we're looking at that as an option. What's interesting is most, to me, having been here 8 months, is that most of our buildings' square footage, there's about 7.5 million square feet. Those buildings were built from between 1916 and 1948, so we have some aged buildings and infrastructure needs. Some of the key outcomes of the plan would include recommendations for optimizing existing space and future space needs. Also include short and long-term capital needs in order to strategically plan for those expenditures like mechanical, electrical, and plumbing as we plan for our future. So General Service would like to prepare an RFQ, request for qualification, in order to find qualified firms to assist the development of this comprehensive facilities plan. We anticipate the RFQ process to take up to 6 weeks, and we would return back to the board with the final cost and the contract. And if approved by the board, we would look forward to the implementation, which could take at least up to 6 months to perform all the work for each one of these buildings.
So Commissioners, similar to what we brought before you for AB Tech and looking at their facilities, this is similar to what we like to do for county facilities. If we will bring this back next meeting, and if this is approved, we will look to have this program into our next year's budget as the plan. This will be possibly coming back before you in March. If the work would start, it wouldn't be done until August of the next year. So we would be looking at having a plan to help us carry forward our capital improvements and our repairs renovation work into the next year or so.
So I'm supportive of this. My question is, what do we have now? Do we have a facilities plan now, or how are?
We don't. The staff, I mean, there's an approach you can use to where you go out and you look at all your facilities, you look at the age of the equipment, but some of the hidden things are the structural needs that might be overseen. Like we've got a project at the courthouse we're going to be spending, what is it, Ronnie, about $3 million on tuck pointing the exterior of that building. So, you know, you don't really get into those findings until you really do a full-blown assessment on these buildings.
The new courthouse?
The old courthouse. I'm
Okay, thanks. Sorry.
Yeah.
So and this is a building maintenance as well as use study. So we're basically looking at the physical structures themselves.
Yes, sir.
What condition are they in? What needs to be done to take care of them in the future?
Yep.
As well as just what are they being used for? Is it
Right.
optimal? Are there some
Explaining.
different ways of maybe doing it to make it more efficient? And
That's
so it's
correct.
looking at both those, and those are really the two questions that it's intended to fully look at.
Yep.
Okay. All right.
Thank you.
Thank you. Okay, next up, Zwigner Building Demo and Retrofit. And Michael Mace is up for this one again, as well as Michael Frew's going to help out, I think.
Mr. Chairman, Commissioners, I brought the wrong file down here, but in any case, what we have, in about 2008, the board, this board and the Buncombe County School Board, thank you very much, agreed to a land and property swap and to start the process for replacing the old Zorgner pool. That's been going on, like I said, for pushing 12 years now. We do now finally have a new pool in place, still working on the programming for that pool and working on an agreement for continuing maintenance and operations. Part of the original agreement was once the new pool was done, the county agreed to get an estimate and demo the old Zorgner building. To date, that old pool has been filled in with gravel, so it's not a safety hazard, but we still have the agreement and an estimate for $90,000 to demolish the old building. In the meantime, we've had that estimate for at least a year now. The school board has determined what they'd like to do is retrofit that building for various storage needs at an approximate cost of $105,000. So the idea now is to bring an interlocal agreement before this board to provide those funds, the $90,000 to the school board toward that retrofit of $105,000, and this would authorize them to use it for those purposes and to maintain and insure that building. So that's the simple part of what the project is, and Mike can describe what they're trying to do with that retrofit.
Yeah, so the old pool is what they're looking for, is to be a warehouse for their equipment, any snow equipment. So it's banked out there at TC Robertson area, keeps them from traveling so far. So they reached out to us and said, look, if the $90,000 is available, we can retro, like Mike said, for $105,000. Therefore, they'd have an 8,000 square foot building for storage in lieu of tearing it down for $90,000.
Does it still leak?
It's had roof patches, but they said that they would reach back out next year, and they're planning to put a roof on it if they could.
So they're gonna,
For the cost, it's about
so we're gonna end up putting more money in it.
potentially, yes. But if you were to build a building like that, it'd cost about $800,000 to $1 million. And
Okay.
they want to invest 90 or 105 to bring it up to where
Yeah.
they could use it.
But they will probably have to put a roof on it.
They will
Okay.
probably have to put a roof, yeah.
All right.
Any questions?
So this is the pre-meeting, so we're not voting on anything. So an issue like that, does it require the commission to say, yeah, we're voting to change plans, or is this just sort of more of an informal conversation we're having?
Well, it's for a formal interlocal agreement to change the funding stream, and budgetary-wise, Jennifer Barnett's made sure that what she wants to be able to do is to change the budget appropriation, that it's not for demolition, it's for a different purpose. And plus, just to enter into that agreement for the work by the school board, they'll fund the extra $15,000 at this point out of their own pocket. They have it, and they'll insure and maintain the building thereafter.
So it would have to come, it would have
So
to
would it
come
at least have to
us.
come back as like at least a
Yes.
consent agenda vote or something like that to
Yes,
approve those
sir.
items?
Yes.
Okay.
Yes, sir.
Okay.
And we're looking for that November 19th.
Okay, sounds good. I think the question about the roof is good, and if, and it sounds like a pretty good arrangement, but if there are some other, immediately foreseeable cost, I do think it's important to look at all those, just so we feel comfortable, like, yeah, preserving this building does make financial sense compared to, other options for provide that storage need. So if there are any other foreseeable costs, I hope when it comes back to us, we can see all of that just to make sure that it's still, we're comfortable with the arrangement.
Yeah, so I mean, is there, to your point, is there anything other than the roof, that we're gonna have to do?
Yeah, because if
right?
it's just $95,000, sure. But if it's going to add up to a much bigger number for various reasons, then I just think we would want to know that. And
And they're okay with that building being there? I mean, it doesn't get in the way of expanding of the sports facilities or, anything around the school, so, I mean, I'm sure.
When I reached out and they asked me about obtaining that building, I asked if they had a master plan and was it going to be in the way, because it is located next to the ball field there.
Yeah,
But they said they didn't have any plans to expand in that area.
okay.
And they wanted to use the building, basically just mowers, snow
Yeah.
plows, things like that.
Okay.
already. Very good. Hey, thank you so much. All right, next up is the COAP grant Safer Together Initiative, and Stoney Blevins is here to talk us through this one.
Good afternoon, Commissioners. We're excited to bring before you today a federal grant that is called the Comprehensive Opioid Abuse Program Grant, or COPE. The timing of this grant is excellent right after we had our town hall meeting. Thanks for all of you folks that were there. I felt like the beauty of that meeting was that there was a lot of good data, and there were certainly things there to reflect on and actually to even be sad over. But toward the end of that meeting, I really loved how we were moving towards solutions and toward action. And the first word in this grant is comprehensive, which I think is very appropriate because, as we all know now, after years of addressing this problem, the only solution that's going to work is a very comprehensive solution. So that means multiple county departments, the city, community partners, all working together in collaboration. And so we're very excited about this grant. And actually, I want to just point out the multiple county departments and individuals that worked on this grant, because it was a lot of hard work that went. So from Strategic Partnerships and Justice Resource Center, Rachel Nygaard, of course, as always, was a key player in pulling us together and keeping us on track. Angela Johnson, and of course Tiffany Iannacho. From the Sheriff's Department, Sarah Gayton, who of course is very involved in MAT and the jail project, and also Sarah Holmes. Performance Management was very helpful to us in the submission of this grant. John Hudson and Brad White. From EMS, Jamie Judd was at every grant meeting that I went to. And then from HHS, Amy Upton, who is our interim opioids coordinator, who's been helping us with planning this year, Dr. Mullendor, and of course Jan Shepard, our public health director, who really is our executive sponsor for all things opioids. So I'm going to turn it over to Jan and let her give you the details of the grant.
Good afternoon. Thank you for having us. This is really good news. Let me see, I'm going to go next. There we go. Okay. So I'm going to give you just a little bit of information, specifics about the grant. So on this slide, you'll see this is kind of an overview. The total award for this grant over 3 years is almost $900,000, $878,803. The initiative is really based on the evidence-based intervention of post-overdose response teams, which have reduced overdose death by 50% in cities across the nation, and is becoming well supported across North Carolina. We know that people are most willing to seek help 24 to 72 hours after an overdose event, and we believe this intervention will significantly lower the overdose rate over the course of these 3 years. This is data that we've presented and that you all, I think, have seen on many occasions. It really represents that we clearly continue to have a problem, and we know that medication-assisted treatment, transitional housing, and offering treatment and peer support in the early days post-overdose are crucial steps in battling the crisis. Again, ED visits across North Carolina are down. However, Buncombe continues to be among the counties with high concentrations of visits by zip code. The overdose ED visits provide an opportunity to connect post-overdose response teams with overdose victims. So the team will support the emergency department, first responders, and also jail referrals that are not part of the MAT in jail pilot that is currently in process. Again, this is data that you've seen before. We're familiar with these numbers. We believe the decrease in deaths may be related to the increase in the harm reduction strategies that we've been pushing out these past couple of years. This fact provides opportunity for overdose response teams to increase access to treatment and recovery.
Excuse me, are those heroin numbers or are those opioid everything?
These numbers are going to be opioid related, so they could be, they could have an opioid base, they could be a combination of drugs, but there is a opioid in that mix if there's more than one.
So I think, I mean, for me, I think it would be good to know the difference because there's other things besides what Buncombe County's done regarding, you know, opioid education as far as pills.
Mm-hmm.
You know, the state's done the SAFE Act, you know, there's, you know, federal, there's all kinds of other things going on. But the thing that, you know, for me personally that I run into with, you know, young men and women that are in a, you know, a spiral towards death is heroin. And heroin is a cheap substitute for the pills and you know, the combination of fentanyl and carfentanil, you know, is, I mean, I think we need to know those numbers in Buncombe County when it comes to heroin and be, so that can be part of our strategy.
Okay, okay. And we do have, yes, we can get those, and we can tease those out. I think part of the problem on the medical examiner's report and the death certificate is that there are, you know, like there are primary cause of death, secondary cause, and other related causes, and so sometimes it's a little hard to tease that out, but we can do a better job of that.
It's worthwhile if we can do it.
Absolutely.
I mean, I had a conversation this weekend about a young man with a family member that had relapsed, and you know, and she told me, she said, you need to deal with the dealers and the enablers. It was, I mean, it was just, you know, me talking to you, and it was this weekend, and it was regarding heroin. And he's a good young man, but you know, that's the I don't like to use the word elephant in the room, but it's kind of where my mind is on strategy's great, and we did have a good gathering. We really did.
We did.
But we're going to have to really drill down into, because heroin is just it's a bad situation in all counties, not just Buncombe, but so.
Right, and the cheap fentanyl that's coming to this country from China and other places is really what is spiking our deaths and causing the larger numbers that we're seeing and the increase in addiction and the word is escaping me, but the crisis around this. It's cheap to make, it's cheap to dispense, and I don't think as a country we have a handle on what to do with how to handle the incoming influx of that.
No, but I appreciate the measuring. Measuring is you know, one of the first steps of recognizing the problem, and then we can kind of go from there with our partners. So.
And we do have a group that's coming together with Register of Deeds, our vital records, and detention center folks to really drill down in that medical examiner's report. So I think in the coming days we'll have some additional information the way that you would like to see it.
Okay, thanks.
Mm-hmm. So this slide just tells you our grant activities. Again, the post-overdose response team, that 24 to 72 hours. We'll be providing medical education and screening, harm reduction, naloxone, case management, counseling. We also are going to bring some transitional housing slots into the mix. we don't have those available for us right now in our county that take individuals who are on medication-assisted treatment. And so that's part of this grant. And we'll actually be able to provide medication-assisted treatment, the actual treatment itself for 50 individuals per year. And we arrived at that number simply because that's currently what Winches, our primary safety net provider in our community, is currently serving every year. Probably isn't going to even scratch the surface of it. So these are the total funds for this 3-year grant. And you'll notice that the grant total is $951,809. That's a difference of around $73,000, which we anticipate to cover in our Health and Human Services budget. And again, this is over the course of 3 calendar years. These are the positions that will be incorporated into this grant. We'll be having an opioid response coordinator, licensed certified medical provider, which we believe will probably be an EMT, potentially a public health nurse. We haven't quite decided on that yet. Licensed mental health counselor and peer support specialist. So we do believe that there's some other benefits that'll be realized through this grant, connection to our syringe services program. That program will now be served by by counselors, which we don't have it currently at this time. And again, the housing option for those on medication-assisted treatment pilot in the jail that are not being covered by that pilot. So our request of you all this afternoon, is that you approve the receipt of these funds into Health and Human Services, that you approve 2 positions, a half-time grant coordinator position and a full-time, certified medical professional that will not begin until July 1, 2020. And so that would be our request for you this evening.
Actually, we're just bringing this forward for information. We'll bring it back at your next meeting for official action and consideration.
Okay.
So I think when you come back, just one question just to prepare you is, I realize you guys are the experts and, I'm not, but I want a good explanation as to why these dollars are put in each of these categories. $800,000 is a lot of money, and we certainly want to use it to the best, for the best outcome. And, I would just want some good detail on that, that would be helpful.
Will do. Yes. Any questions?
Thank you very much.
Thank you.
All right, commissioners, that completes the agenda that we had prepared. Are there any other items that people want to talk about before we adjourn?
I do have one, if I can bring that up now. We've had our 8 public meetings with partnerships on the Brandon Rachel. Strategic planning, we had 8 meetings, and we had almost 200 people to come to those meetings. Our ask tonight, we had 47% of the folks that came from outside of the city limits and about 53% that were in the city limits. Our question tonight is, we've had some feedback about additional meetings out in the county, not all here at 200 College. We've had some additional conversations about that.
Mm-hmm.
So my question to you is, if we do that, we'll be postponing the November 15th work session with Rebecca so we can get that additional input into that conversation. So 2 questions for you. Do you normally have a second meeting in December? I think in the past we've kind of canceled that. We would love to postpone the November 15th to the second meeting in December if you're having one. So we would get time to go out to the districts and have meetings.
So have 2 meetings in December instead of 2 meetings in November.
Yes, well, the November meeting was not on a board meeting, it was on a Friday, and it was a work session to talk about what we heard from the public and to look at the goals that we've crafted so far.
So we'd still have the meeting on the 3rd Tuesday of November.
As normal.
Right,
but we would
and
cancel
then we
the
would
November
have, in terms of
15th.
commission meetings, have how many meetings in December?
2. We
On
would
the
have-
1st and 3rd Tuesday.
Yes, sir. And we would postpone the November 15th meeting. Unless you guys are okay with the input we've had so far, we can move forward with that. But if you want to postpone that meeting, we would do additional public sessions.
So it would be December 3rd and then December
17th.
17th.
Yes.
And
What's the first meeting in January?
Is that
The
the
7th.
5th, the 7th?
yeah. Is there anybody who could, I mean, we could keep the agenda light, I would
Yeah.
assume, but is there anybody who could not be here on the 17th? It's okay with me. I think having the extra meetings is really important.
Okay.
Yeah, it is.
So, does that work for everybody?
And we'd wait to see when Rebecca could.
We've reached out to her already, and she's available on that day.
The
She,
17th?
the 17th,
Okay, so our session with her would be the 17th.
yes. So we would cancel on your calendars, now we have a hold for the 15th, we will cancel that session, and we will have Rebecca here on the 17th of December.
All right. I don't hear anybody saying that doesn't work, so let's plan on that.
Thanks.
That it?
Yes, sir.
All righty. All right, if there's nothing else, we're going to adjourn. We'll reconvene at 5 o'clock for the regularly scheduled meeting.